Hello and welcome. We are back with your favorite series where we talk about celebrities and the medical conditions that you didn't know they had. Today's hot topic is Kim Kardashian and Cara Delevingne. I promise you now, mark my words, that you are going to go away from this video learning at least one thing that you didn't know before. So, should we get into the video? Let's go. So what is the medical condition that both these celebrities have in common? It's a condition called psoriasis. You may have seen Cara making a statement at the Met Gala where she was naked from the waist up, covered in gold paint, but she left her elbows exposed, showing us that she felt comfortable in her own body and particularly to show off her skin condition. Did you know that psoriasis was included amongst the very skin conditions that was called Zara in the Hebrew Bible, which translates to leprosy, and it was thought to be a punishment imposed for slander. The person suffering from that skin condition was deemed to be impure and they were treated by the Kohen, which is a Hebrew word used to describe a priest. So what exactly is this skin condition? Well, you might have not heard the name before, but I assure you, you've probably seen it on someone around you because it affects a whopping 2% of the population, which is why it's not unusual to see many celebrities suffering from this condition as well. But psoriasis is more than just a skin condition. You will soon find out. Let's get down to the basics. Psoriasis is a chronic skin condition, and it's well known to cause thickening of the skin, causing these white plaques. And if you've watched the other videos in this series, you know that there's a running theme as to cause of these conditions. That's right, it's your immune system. The immune system causes a cascade of issues, causing the top layer of your skin to proliferate. This top layer normally replaces itself every 30 days, but in psoriasis, this happens every 2 to 3 days. How's best to describe this? Have a look at this photo. So these are the layers of the skin. The top layer is the epidermal layer, which has cells called keratinocytes, and they produce a substance called keratin. You might have heard the protein keratin used for things like hair, but it's actually a very, very important part of the skin. It helps the skin become waterproof and prevents infections from being able to enter the body. For some reason or another, we are taught that there are some triggers. These can be things like trauma to the skin, an infection, and medications that activate the immune system in such a way where it starts to cause inflammation within the top layer of the skin. These cause these keratinocytes to be active so that they divide and multiply at a faster rate. And this is what leads to that plaque. It's essentially a buildup of keratin. These cascade of events can cause other issues within the body as well. And Kim Kardashian has spoken out about how she's suffered from the other effects of this. And we'll go on to that shortly. Psoriasis does have a genetic basis. And we do know that Kim Kardashian's mum also suffers from psoriasis, and unfortunately Kim is the only one out of her siblings that has been affected by psoriasis. But besides genetics, there are other things that increase your risk as well. For example, if you have a HIV infection, lifestyle things such as stress, smoking and obesity, certain infections such as having a throat infection caused by strep, and last but not least, the culprit that we see in many, many different illnesses, medications. Interestingly, in Kim Kardashian's situation, her psoriasis actually got better when she was pregnant. Now, if you think about the logistics of being pregnant, you are carrying a baby that is half your DNA and half somebody else's. So your body has to adapt and almost dampen your immune system to be able to accept that this baby that has foreign DNA growing inside you. Otherwise, the baby would be rejected. For this reason, many autoimmune conditions such as psoriasis, rheumatoid arthritis, thyroid issues actually get better when the patient is pregnant. But as mentioned, it has caused a lot more issues for Kim other than the skin condition. She talks about an event where she was showcasing her new sunglasses range and spoke about having a lot of pain in her elbows and her hands, and she initially thought it was due to a gym workout that she did the day before, whereas in fact she was suffering from psoriatic arthritis. Yes, psoriasis itself and the cascade of events that lead to it can also affect the joints as well, leading to arthritis. And if the skin condition and having psoriatic arthritis wasn't enough for these patients, they are also at an increased risk of having psoriatic nails, they're increased risk of having heart attack, high blood pressure, diabetes, Crohn's, and many, many more. Luckily, we have moved on from the days where we treat the skin condition with Fowler's solution. In the 18th century, Fowler's solution is what they use to treat psoriasis. It contains a poisonous and carcinogenic arsenic compound. The English doctor Robert Willan is the founder of dermatology as a medical specialty in itself, and he was the one who finally differentiated psoriasis as a skin condition of its own and no longer related to leprosy. So how have we moved on from the Fowler solution, and how come we don't see Kim Kardashian and Cara Delevingne with these psoriasis flare-ups all the time? Well, there are lots of treatments available in the form of creams, phototherapy, and medications. Interestingly, a cream containing vitamin D is known to reduce the keratin buildup that we see characteristically in psoriasis. It is well known by patients that going out into the sun and sunbathing helps their skin condition, and this has been medicalized to offer treatment for patients, and it is termed phototherapy. This is often offered for patients who are at low risk of skin cancer, as we know that phototherapy can increase your risk of skin cancers such as melanoma. In fact, in the US, there are tanning shops that report that up to 50% of their clients are those that are suffering from psoriasis and coming for their own phototherapy as they can't get an appointment with their dermatologist. That leads us on to our last treatment. As we've said from previous videos and the video today, is that psoriasis is an immune-driven condition. So we can give the patient some medication that essentially dampens down their immune system and prevents this reaction causing the keratin to build up. There you go. It's been a jam-packed episode again, where we talk about the history of the medical condition, the science behind it, and a little bit of celeb gossip. I'm sure you have learned at least one thing today that you didn't know before, and that is all that I care about. But I would love you to like the video if you did enjoy today's content, and subscribe if you haven't already. I would love to have you as a viewer. Follow me on the other socials, and I'll see you in my video next week. Bye.